Arthrix presents an arthrodesis of the first tarsometatarsal joint using the Arthrix Plantar Lapidus plate. An incision is made at the medial aspect of the first tarsal metatarsal articulation, being careful to avoid vital neurovascular structures. In addition, the tibialis anterior tendon should be identified and protected. Additional incisions can be placed distally to access the medial aspect of the first metatarsal phalangeal joint, as well as the lateral aspect of the joint if a soft tissue release is to be done. At this time, the first tarsometatarsal articulation is prepared by removing the cartilage and preparing the joint for a standard arthrodesis. A K-wire can be used to fenestrate the fusion site prior to joint reduction. At this time, the surgeon should apply a bone graft such as AL-selwi soaked in bone marrow aspirate or Arthrocell viable cellular bone graft. Once complete, if a pronation component is contributing to the deformity at the metatarsal, insert a K-wire into the metatarsal shaft to realign the sesamoids. Finally, another K-wire can be inserted across the joint to maintain the desired intermetatarsal angle. Further reduction of the intermetatarsal angle can be achieved before advancing the same K-wire into the base of the second metatarsal to hold the correction. Next, the appropriately sited plantar plate is placed on the plantar surface of the first TMT joint, with the proximal aspect of the plantar plate placed just proximal to the tibialis anterior tendon. A BB tack is placed at the distal medial screw hole to hold the plate in the appropriate position. At this point, if the plate is resting off the bone at the proximal medial cuneiform, a plate bender can be used to contour the plate down to the bone. The plate can also be removed to more easily bend the plate if desired. Finally, a second threaded BB tack is inserted into the proximal aspect of the plate. Prior to implanting screws, it's important to confirm appropriate plantar placement of the plate, utilizing fluoroscopic confirmation. Finally, a 3.5 mm locking tower is inserted into the plantar distal locking hole, and a 2.5 mm drill bit is utilized to drill through both cortices. Initially, a cortical screw can be used to bend the plate down to the bone. Insert a 3.5 mm locking screw into the distal hole in the plate using the same technique as previously highlighted. Next, a 2.5 mm drill is used to prep for the 4.0 mm interfragmentary screw. The drill should be aimed at the dorsal lateral aspect of the medial cuneiform. Furthermore, an optional 4.0 mm drill can be used to overdrill the metatarsal. The screw length is then measured with a depth gauge. At this time, a 4.0 mm cancellous screw is placed in the compression hole at the inferior aspect of the plate. Remove the provisional K-wires and BB tacks before completely tightening down the screw in order to achieve maximum compression across the arthrodesis site. Follow the same technique for inserting the final two locking screws into the proximal aspect of the plate. This completes fixation of the arthrodesis construct. Some advantages of the plantar lapidus technique include more simple dissection, preparation of the arthrodesis site through a medial approach, and applying primary fixation to the tension site of the arthrodesis. This in turn may allow earlier weight bearing and reduce the possibility of non-union.